I have this whole me a heads up out there if they can see and or hear me. I'm going to just drink. Here's what I can do. Help. All right. Tell me. Somebody. Am I working? Am I working? Okay, well, I'll take that. So I'll take that thumbs up. I'm going to give my mask rant, then we're going to see how it goes. So I'm going to start it over because I want to make sure you didn't miss the beginning part where I had my prop. So there are two kinds of regular masks that are used in the healthcare community: N95s, surgical masks. N95s are called that because they filter out 95% of particles. That's what they're for. You wear them to keep from breathing in the particles, and you only wear them when you intubate somebody and you're going to have blood spatter or respiratory spatter, something like that. So they're very rarely used in the healthcare community, but they're used for certain procedures. Surgical masks are worn by doctors to keep from infecting patients. That's the whole purpose of them. They were never designed to do anything else. They are there to keep you, the doctor, from infecting this patient who might have like a bloody gash open or something with any diseases you have. That's the point. And that's the first thing you have to understand. Here's the second thing you have to understand. SARS-CoV is a tiny, tiny virus. It's like 120 nanometers across, but usually we expel it on like little globs of saliva or mucus or something like that. And those are bigger. Okay. So when we're dealing with this, you have to remember tiny virus, big globs of stuff. So first, anything that we're talking about in terms of masking, we are talking about a marginal utility. The biggest gains that we're getting in flattening the curve are going to come from social distancing, hand washing, and especially isolating people who are sick. So the thing that we're talking about, and the reason CDC put out this guidance, is essentially to keep people who are asymptomatic but who have the virus from shedding it. And so the theory goes, if you put something over their face, then they're going to shed it less and it's going to protect other people. So it's another one of those things. You are not, you're not wearing your bandana mask to protect yourself. You're wearing your bandana mask to protect other people from you who might be sick. And so the rates of this, the rates of help for this are going to be fairly low. These are not meant to be that effective. We're looking at something that is not going to be a massive hit to the infection rate, but it's better than nothing. That's what all the studies say. If you read them, they're like, well, this is a last resort. It's better than nothing. And what that means is social distancing is the most important thing, not wearing masks. So with that said, that's message number one. Message number two is, if you're listening to me right now and you can see me and you have a cache of N95s or surgical masks at your house, what you need to do is stop listening to me talking right now and go and donate them to healthcare workers right this second. If you have surgical masks or you have N95s, you should donate them immediately to somebody else, to a healthcare worker. There are lots of places on site, on websites and things like that you can do them. You should not be messing with that stuff right now because there is a shortage and they are doing procedures where they really need those things and they could get killed. And for you, we are talking about a 3 to 4% chance of infection one way or another that masks might help with. That's the end of that story. Now, here's the thing about masks and the reason that they worry me. The reason masks worry me is because you have to deal with two things. So here's my little handkerchief mask. All right. So I have it on and I want you to notice three things. First, anything that's cloth that I'm breathing into is going to get wet first. And if it's acting as a barrier for the virus, it theoretically could get virus plugged into it. That's thing one. Thing two is it doesn't fit well, right? There's all of this space around it. There's floppy space here. There's floppy space here. Even if you have elastic bands going above and below your ears, the fit rate is going to be 40% or so less effective than a surgical mask fit. That's your main problem. And so the terrifying study, well, here are two terrifying things. Back in 2006, the Institute of Medicine did a study on what we might need in a pandemic. And they said, you know what? We might get to the point where we recommend that people wear cloth masks. So people, you guys should study that. the Institute of Medicine said, go out, study cloth masks, come back with evidence-based recommendations. And then nobody did it. Maybe, I mean, that's not true. Maybe 4 people did it. But all of the things that you're seeing in the news are based on legitimate 4 studies out there in the world. And of those studies, only one study that I have been able to find, that anybody else has been able to find, that I can tell, is based on actual people in the world. There was a randomized control trial of Vietnamese healthcare workers, and they did 3 things. One group wore surgical masks all the time, one group wore cloth masks all the time, and one group followed whatever their standard practice was. Sometimes they wore masks and sometimes they didn't. Spoiler, the thing about that study was it showed that the healthcare workers who wore the cloth masks were the most likely to be infected at the end of 4 weeks. They were worse than the surgical mask, not a surprise. They were also worse than the control group who didn't wear masks all the time. Now, there's a lot underpinning that. Some of that might be because people in the control group, sometimes they wore surgical masks, sometimes they didn't. But the other thing about it is hard to wear a cloth mask well for the reasons that I just laid out. So if you're wearing the cloth mask and you get it wet, then it is a source of virus for you. So you have to make sure that anytime you get it wet, you either have to destroy it or you have to be able to wash it. That's why the masks that have like the filter inserts are weird to me, because you have to destroy it or wash it. So if you have a filter insert, presumably you're going to need to destroy that, but you've got to wash the actual mask too, right? Or else it's going to be like a walking container of like virus you're going around with, right? So anyway, the reason that cloth masks are a problem is because taking a mask off and putting it on is something that is difficult. Legitimately, I will tell you this. I have gone through 4 hours of training on how to put on and take off masks. And it's not because I'm that much of a slow learner. I'm kind of a slow learner, but it is difficult. And the reason it is difficult is because as soon as you do this, okay, I have my little mask on. Okay, as soon as I do this, then I've just contaminated my hand, right? And so if I take my mask, I've been a good mask wearer all day. Okay. I take it off and then I go, boy, whew, what a day. Whew. You know, at that point, I am likely worse off than I would have been if I had not worn a mask that day, right? Wearing a mask takes care. And so my family, we're following the New York City Health Department guidance on wearing masks because everybody should. You should listen to your public health authority. But getting a 5-year-old and a 2-year-old to do good mask wearing practices to go on an outing is no good. You got to watch that. So I'm going to walk you through, based on that warning, how I think you can do this best. Because this is not magic, but it is tiny. This is not dust. It's not even bacteria. It's a virus that